Hello, my name is Ariane Buenrostro, and I will be reading Professional English in Use Medicine chapters 14 to 23. Symptoms and signs. Describing problems. The problems which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as finding or examining the patient. For example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaints, doctors say. Mr. Farnsworth was admitted complaining of chest pain. In case note, the abbreviation COS is used. Presentation. Patients say they went to see the doctor. Doctors say the patient presented the symptom which causes a patient to visit a doctor or present to present is called the presenting symptom, presenting complaint or presentation. His presenting symptom was chest pain. He presented to his GP with chest pain. The usual presentation is chest pain. Talking, talking about symptoms. Um, Symptoms: tiredness, lethargy, fatigue, and lassitude. Meaning, loss of energy. Patients say, I feel tired all the time. I feel completely worn out. Lately, I've been feeling completely exhausted at the end of the day. Next is malaise, meaning general feeling of being unwell. Patient say, I feel unwell. I don't feel well. I've been feeling of color for 2 days. I haven't been feeling myself for a week. And I've been out of sort all day. Anorexia, loss of appetite. Patients say, my appetite is very poor. I've been off my food for days. Weight gain, increase in weight. Patients say, I've put on 8 kilos in the last year. I've gained 5 kilos. Weight loss, decrease in weight. Patients say, I'm not eating any less than usual, but I've lost a lot but I lost a lot of weight recently. Constipation, heart, infrequent and feces. Infrequent feces. Patient says, my motions are very hard. I've been quite constipated lately. I'm not very regular. Now, complete the table with words from the opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Noun, adjective. Exhaustion, exhausted. Fatigued. Lethargic. Tired, tiredness, tired. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Complain of color, out of sort, present with, put on, worn out, worn out. Complete the sentences with the correct form of the verb present. A 67-year-old man presented a 9-month history of increasing shortness of breath. The most common presentation is loss of consciousness. Cranial arteritis may present as fever without any obvious cause. The patient usually presents with a sore throat. The presenting symptoms is this patient could perhaps be due to renal failure. Other conditions with a similar presentation include acute cholecystitis. Reduced growth is an important presenting complaint of celiac disease. 2 months following presentation, the patient was able to walk. Read the patient's description of her symptoms, then complete the case report. Look at the opposite to help you. I was well until a few months ago. In the beginning, I just felt of color and a bit tired. But lately, I've been feeling complete worn out at the end of the day. I'm not I'm not eating any more than usual, but I've put on 9 kilos in the last year. My motions are hard and my hair has started to fall out. Case 13. A 50 years old housewife who had been well until 4 months previously complained of tiredness and malaise. She had gained 9 kilos in weight in the year before she presented to her EP. Although she denied eating more than usual, she was constipated, and she noticed that her hair had started to fall out. Over, over to you. Write short case report about this 60-year-old man. I haven't been myself for several months now. I feel completely worn out after doing anything. I've been off my food and I've lost 10 kilos in weight. Write in the past tense and use medical terms of the underlying expressions. A 60 years old man presented with fatigue, loss of appetite, and weight loss over several months. Now, in Spanish. Síntomas y signos. Descripción de problemas. Los problemas que un paciente le comunica al médico se llaman síntomas. Por ejemplo, dolor o náuseas. Los signos son los que el médico encuentra, también conocido como hallazgos. Al examinar al paciente, por ejemplo, presión arterial alta o frecuencia cardíaca rápida, los síntomas también se conocen como quejas. Para informar sobre los síntomas o quejas de un paciente, los médicos dicen, el señor Farnsworth ingresó quejándose de dolor en el pecho. En las notas del caso se utiliza abreviatura C/O, dolor en el pecho. Presentación. Los pacientes dicen que fueron al médico, los médicos dicen que el paciente se presentó. El síntoma que hace que un paciente visite un médico o que se presente se llama síntoma de presentación, queja de presentación o presentación. Su Síntoma de presentación fue dolor del pecho. Su queja de presentación fue dolor del pecho. Se presentó su médico de cabecera con dolor de pecho. La presentación habitual es dolor de pecho. Hablando de los síntomas. Síntomas: cansancio, letargo, fatiga y lasitud. Significado: pérdida de energía. Los pacientes dicen: me siento cansado todo el tiempo, me siento completamente agotado. Últimamente me siento completamente agotada al final del día. Malestar: sensación general de malestar. Me siento mal, no me siento bien. Me he sentido desanimada durante 2 días. No me he sentido yo misma durante una semana. He estado de mal humor todo el día. Anorexia: pérdida de apetito. Tengo muy poco apetito. Llevo días sin comer. Aumento de peso. Aumento de peso. He subido 8 kilos en el último año. He subido, he subido 5 kilos. Pérdida de peso. Disminución de peso. No estoy comiendo menos de lo habitual, pero he perdido mucho peso últimamente. Estreñimiento. Heces duras e infrecuentes. Mis heces son muy duras. He estado bastante estreñida últimamente. No soy muy regular. Nota: el verbo sentir también se usa con otros adjetivos como calor, frío, nerviosa, ansiosa, mareada, débil. Por ejemplo, dijo que se sentía mareada. Thank you for watching.